I'd like to be joined now by Carl Hennigan, Professor of Evidence-Based Medicine at the University of Oxford, to talk about fat jabs. Oh, and the latest concerns about how safe they are. Very, very good morning to you, Carl.
Good morning, Julia.
Very first guest I had on fat jabs when they were all in the news about, oh, these miracle cures for weight gain. Everyone loses weight. They're brilliant. They're safe. They save you from everything else. They're a miracle. Was you. And you were basically telling us about the actual studies carried out by the likes of the Mounjaros and the Wegovy's and the Ozempic that actually didn't show quite such a good picture in terms of their ability to achieve people's weight loss and sustain it. But more and more concerns have been raised about some very unpleasant side effects, not just, the apparently constant diarrhea and bad breath or the like, but other issues as well. Now a really very serious concern about women whose contraceptive pill may be interfered with by the impact, particularly of Mounjaro, the most common drug people are using, but also of pregnant women and women who are breastfeeding and the risk to their babies. Tell us what the research suggests.
Well, I think you'll find, Julia, last time we spoke, we mentioned this because it's already in the summary of the product characteristics in the patient information leaflet.
Right.
What animal studies showed is there was an increase in fetal abnormalities and an increase in pregnancy loss. And what the issue is, in humans, the data is extremely limited. So the advice is always...
Because they don't test on pregnant women, funnily enough.
Well, what happens is you throw it out there like now and your words were the game changer and then you see what happens. So what's happening is women are becoming the experiment. And because they can buy this online, they can go out and get that freely, that actually they're not getting the right advice. And the advice has always been that actually you should take contraception 2 months before, and actually you should not take this whatsoever during pregnancy. The issue now is with the Mounjaro is they're saying, well, actually it has an effect on the contraception, so you need to take a non-oral contraception for at least 4 weeks when you start this treatment. But the problem here is they say the MHRA are now coming to the party late as ever.
This is the Medicines and Healthcare Regulatory Agency.
They should not be bought without a prior consultation. But you can go online today. You can find that it's on sale. It's been reduced from £210 to £125.
Oh, wow.
You get it with no appointment, no GP visit is necessary. And our supermarkets have doctors now that make this available. So what we're seeing here is the rise of the conflict of interest and the big industry with the amount of money being made here is in the billions. This is being put out there to a wider spectrum of people, and women in particular are using this in an unregulated fashion.
Yeah.
We have significant problems.
In
addition, since we last spoke, Julia, the evidence has come out that, yes, while people are on this drug, they actually do lose weight, like they do with all sorts of slimming programs.
Yeah.
But about 8 months after they finish, guess what? They're back to where they started.
Just 8 months later.
Yeah.
I mean, I know so many people who have just started it and people who have used it. I'll say, oh, you look well. Yeah, I've been using, a fat jab. And people are always just absolutely thrilled. But again, the evidence from the company's own trials was very clear, was that people would put the weight back on. And I thought the most telling things was pension companies. I mean, actuaries, I'm sure exactly the same as well. The people who have to basically deal with the outcomes of whether people are living longer, living healthier, or living shorter lives is that they have not changed any of their payments on the basis, well, obviously people are losing weight, they're keeping the weight off, they're not getting heart disease, not getting cancer, they're not getting diabetes, they're living longer. We're going to have to cut some of those pension annuities because basically we're going to have to be paying it for longer. They deal with the actual facts. Well, they don't think people are going to live longer. So again, even when the NHS and the health secretary say, oh, we should be giving this out on the NHS because this will help people to be healthier and live longer. Well, it doesn't look like it will work unless people stay on these drugs forever. And of course, the cost of that and crucially also the side effects, the long-term impact of that, never been tested.
So one thing is, NICE says the recommendations is you shouldn't go on it for longer than 2 years, so you can't get it on prescription, because if you haven't changed your lifestyle and lost the weight and changed everything and you're exercising more, you can't stay on it forever.
Well, you can get it online.
Yeah, but that's what it's for prescription, so actually you're going to force people online to get it. That's the problem. Second is, the longer you're on it, the adverse events, more serious ones get greater, like pancreatitis. But third, everything is linked. Your previous call was about children and the free school meal. We have an obesity crisis that is starting in children, and we have to have a strategy that says in young children, we need to get them out there healthier and fitter and exercising. That's where I'd be putting my money.
Yeah, absolutely. And it's interesting. We've even had people debating whether or not this drug should be given to children. Well, I mean, my God, well, these are the same people who were talking about giving the COVID jab to children when even there was no medical evidence whatsoever for that for healthy children. It is extraordinary how often a pharmaceutical solution is often sought rather than the simple practical solutions of, you know, eat less, exercise more. And even when they were saying, even if you don't lose weight with these jabs, the benefits are still good for cancer risk, heart disease, diabetes and all that. But actually, eating less and exercising more is good for so much more, all these other aspects of your body, bone density, your mental health. I mean, I've certainly in the last 10 years been so much more physically active than I used to be. And you just feel so much better for it. Your whole body feels different. Your head feels different.
We'll be putting you forward for Public Health Director in charge of medicine in a minute,
As
Julie.
long as I can still have my white wine and my Prosecco, I'm fine.
Yeah, I'm with you on that. But interestingly, what you end up with is a perverse incentive where people say, oh, to get this prescription, you have to have a BMI of 40. I'm going to eat my way to there, and then I'm going to take the medication. And that's how we fuel society with this approach that there's a simple fix around the corner. It is not simple, and we need to have a strategy that starts with what you're talking about is in childhood, moving through our adolescence and into adulthood, people need to exercise and be healthier. It's not rocket science. Keep it simple, but we have to all contribute to the solution. Yeah,
absolutely. But again, there's a difference between someone, you know, a man or a woman making a decision about their own body and it's legal. You know what? If you don't want to read up on this properly, you don't want to pay attention, you don't want to live healthily, you want to take the drug, you know what? I don't know why it's my problem. The pharmaceutical companies are going to tell us whatever they want to tell us to make as you say, billions upon billions that they are making from these drugs and trying to get them on the NHS, get them to everybody. And what they really want, as we know, pharmaceutical companies, the El Dorado is always a drug that people can get on for life. That's where the real money is being made. They don't want to cure people. You don't get money for curing people. You get money for keeping people on drugs permanently. But when it's unborn babies, when it's newborn babies being breastfed, I find it extraordinary there hasn't been more clear warning about this. I mean, you know, as someone who lost 4 babies to miscarriage, and I'm always amazed by how casual people can be about what drugs they will take. And I had terrible morning sickness, as in absolutely couldn't lift my head without throwing up for months and months on end. But you know, why don't you take a drug? Yeah, well, the last time they did a drug for that was called thalidomide, and I wanted my baby to be safe. We're told, like, don't even take paracetamol unless you really, really need it. And then women are giving themselves a drug for weight loss while pregnant. That's insane.
So we've had a real wake-up call recently with, you go about thalidomide, it's actually today sodium valproate in epilepsy, doubled the risk of congenital malformations. It took 20 years for the regulator to get its act together and say, look, we've got to stop giving this to women of childbearing age, not women who are wanting to get pregnant.
But who might get pregnant.
So I suspect what will happen here, this will take a long time before the warnings come out and say women of childbearing age shouldn't take this drug.
Yeah. There'll have to be legal cases. There'll have to be some children who were born or deformed or before that. That's what's so awful and tragic about this. Carl, you've been fantastic on this issue. People need to know more of the facts, and everyone's just walking around going, oh, this is a miracle drug. There's no such thing. It doesn't exist. Carl Hennigan, Professor of Evidence-Based Medicine at the University of Oxford. Thank you. Philip Ingram, being tempted at all?
Well, any drug that you put inside...
That sounds like a rude question. I don't mean it in that way.
Any drug that you put into yourself will have side effects. Yeah. And whenever the body's going through huge changes through pregnancy and all the rest of it, the dangers are significant. And a lot of the things, the way the body chemistry works, isn't properly understood. No. The drug companies certainly don't research it.
They don't test it on pregnant women for a reason.
So you shouldn't take anything, really, without very, very careful supervision by doctors.
Exercise more. There you go.